Lawrence Cheptiram. I'm the Operations Director at Beam Children's Foundation, a non-profit organization working in Tarbo, Eldoret, Kenya. We provide educational scholarships and mental health counseling to vulnerable children in the slums within Tarbo. I learned of Humanitarian Global through a friend and wanted to do a training on leadership and project management. And I got a chance to attend a training, a 4-day training on project management. And I've learned a lot. My take home would be the change management and communication that I intend to put into work once I get back to my workstation, and see to it that this improves the services that we deliver to our clients.
Hello, everyone. Please confirm that you can hear me. Yes, I believe I can hear you. Thank you so much for joining this session. Today, we are having our webinar on bridging the gap using SBC to connect policy, practice, and local knowledge. And I want to take this opportunity to thank you all for joining and being able to just take up time for us to be able to have this interesting session on SBCC. This would be a good time for you to introduce or invite your colleagues, your friends and family, whoever are interested in SBCC, so they can be able to get to learn something about of this. And with that, I think we can be able to start. What will happen is we'll have our introductions, and then after the introductions, we'll get to have any updates from Humanitarian Global. And then from there, now we'll give our expert for the day to be able to give us what he has in store. Then after that, we will get to have our session on question and answer. So anytime maybe he is mentioning something and you have a question on it, you can either post it on our Q&A section, or you can just wait and then we will be able to give you a chance to be able to speak once he has finished his talk. So I believe we are okay for us to be able to start. I would want to get to know where you guys are coming from, what you do. Like, for example, just write it on chat. Hi, my name is Pamela from Uganda, like that. But now I get to know who we have for today. Like I can see Pamela said hi, Pamela Blessed from Uganda. And then you also have Tesfaye Haresi from, yeah, he's just saying yes. Thank you so much. So just drop in your messages and then we'll be able to give a shout out for us to also acknowledge your presence as well. But then I will still insist, do share the link to everyone, especially if they are in the SBCC field, for them to get to join this session and for us all to learn something out of it. And then we want to now read what some of us have written. So we have Dudu from Eswatini. Welcome to this session. We have Edward from Hand in Hand, Eastern Africa in Kenya. Welcome, Edward. We also are joined by Valeria from Zimbabwe, as well as Alalim. As well as Alalim. We have Alalim, yes, from Sudan. Welcome, Alalim. We have Tesfaye, yes. Tesfaye has talked about from UNICEF, Ethiopia. You're very much welcome. We also have Gasho, sorry if I'm mispronouncing your name, from Ethiopia. And then you also have Lydia Esther from Kenya and Henry from Adra in Mozambique. So thank you everyone for just telling us, where you are and where you're joining us from, as well as Soyaden from Denham. We have Ntipapa from Kenya, Caroline from Kenya, Hand in Hand, Eastern Africa. Thank you so much for joining. We have Reja Dem from Benadir University in Somalia. Teresa from Kenya, you're very much welcome. We have Chisom from Nigeria. And then we have Wezi from Zambia and Alexandra from Cape Verde. Thank you, everyone, for just having the time to be able to join that. I will also want to take the chance to introduce the team that I have here. They have been able to make this session very, very interactive for us. They've just been able to organize the whole aspect, and we are getting to have this session because of them. One of my colleagues has stepped out, so I'll give this chance to Brian to just say hi, and then he will be able to come in later to give us updates. Brian?
Hey Sheila, I hope I'm audible enough. And
Yes, you are.
hi everyone. Thanks to everyone that has taken their useful time to join this resourceful session. We do appreciate. So, as Sheila has
Mhm.
mentioned, my name is Brian, part of the technical team. My work is to ensure that this event is a success. So, welcome. I'll be at the back watching.
Great. Thank you. Thank you so much, Brian, for that. I also want to give a shout out to Samuel Lesiamito from Kenya. Also, he is happy to be here, and we are also happy to have you here, Samuel. So something else, as we get to have any updates from Humanitarian Global, please try as much as you can as the trainer is speaking or as our expert is giving his presentation or his discussion. Please, if you have any questions, kindly drop them in the Q&A section. We have a Q&A section and a chat section. So drop your questions on the Q&A section, as well as any comments that you might have as we are talking about bridging this gap. And then from there, we'll have a session where we will get to ask those questions, all of them, as we move along. So with that, allow me to bring on board Brian back to be able to give us any updates from Humanitarian Global, and then we can be able to proceed.
Okay. Thank you. Also, please confirm if you can see my screen.
Yes, we can see your screen.
Okay, thank you very much. As I've mentioned to everyone that has joined this resourceful session, and we look forward to an eventful session, and we do hope that you get to gain a lot. So, for those that do not know, our institute is called Humanitarian Global Institute, and we are a training and learning solutions. We offer training and learning solutions, to humanitarians and development practitioners. For those who have not interacted with our mother website, a link will be shared on the chat section so that after the webinar, you can explore some of the programs we offer. But just quickly, an overview of the programs we offer. We offer online courses such as monitoring and evaluation, water, sanitation, and hygiene, human nutrition and dietetics, procurement and supply chain management, disaster risk reduction and management, food security and nutrition in emergencies, maternal, infant, and young child nutrition, among many other courses that are resourceful to humanitarians and development practitioners. So if you've not had a chance to have a look at our website, after the webinar, you can quickly go there and have a look at what fits you. We do also offer training workshops such as the social and behavior change communication, which I'm sure most of you are interested in, and among other areas such as environmental and social safeguarding, writing winning proposals for donor-funded projects, fundraising and resource mobilization, grants acquisition and management, finance management for NGOs, data collection using various tools, data analytics and visualization also using various tools, and finally, leadership and project management for NGOs. This is just a tip of the iceberg. We do have many more customized workshops based on your request. If you'd like us to train your team in other areas that are not indicated here, you can as well just let us know so that we can organize the customized. We can do it physically um, in Nairobi, or we can come at your premises, that is, or you can also opt to do it online, which a similar approach that we are doing the webinar. So quickly onto the social and behavior change communication training workshop, which is an upcoming training workshop that we have in the month of April. Let me just get the dates right. We do have our calendar for the year 2025. So let me just have a look. We offer so many areas. Some of them just ended last week. We've had so many workshops in the month of January, February, and now we are in March. So in April, we do have the data analytics and visualization using SPSS and Power BI. We also have grants acquisition, and then the one that you anticipate the most, the social and behavior change communication, which runs for a whole month, and classes happen twice a week. So if you are interested, a link will be shared by Sheila on the chat section, so that after the webinar, you go and register for it so that you don't miss out. Remember, we are taking a maximum of only 10 participants to ensure that the quality is maintained, so that we have individualized care for every participant, so that you can, once you finish the training, you can actually say that you really did a quality training with Humanitarian Global. So if you've not registered yet, a link will be shared there. And just to cover that are going to be a few areas that are going to be covered in the workshop include you'll get to gain an understanding of the key factors of human behavior and SBCC strategies and principles for essential communication planning. You're also going to get an improved understanding of communication strategies and channels that facilitate sustained behavioral change. An important area, I'm sure you are interested to learn more about that. You'll also get to learn more about how to conduct effective monitoring and evaluation of SBCC campaigns. So if you're really interested in those brief areas that I've mentioned, there is so much more. You can have a look at the course outline right there. And then after the end of the training, you get to receive a certified certificate from Humanitarian Global, which has been accredited to help you advance your career. So there's so much to offer over here, so much to learn. If you really want to advance your career, so there's no other option but to click on the link and join us in the April session. So thank you very much. That's just a brief overview. I don't want to take too much of time, so that our facilitator for the day can cover the topic that you came for. So thank you very much, Sheila, and I'll be at the back watching and also seeing that we do receive some people that are interested in this, so that we can have a wholesome class. So thank you very much, Sheila.
Oh, great. Thank you. Thank you so much, Brian, for the work that you're doing behind the scenes. We truly appreciate. And I hope that we all have been able to see what we have in store. So in the meantime, if you're interested to learn more about our upcoming trainings, please reach out and share with us your contact details, and we will be able to guide you through the process and even possibly tell you more about what the training will entail before you get to enroll. So with that, I think I want to bring on board our expert for today. He was not able to introduce himself as we were doing the introductions, but I believe before he starts, he'll get to tell us a bit about himself, and then he can proceed to take over the session. Brian, you're welcome.
Thank you, Sheila, and Jim. I do appreciate this opportunity to once again SBCC and how then we can bridge the gap between the communities that we serve, and particularly putting in mind that Humanitarian Global, you're targeting development practitioners. You're also targeting humanitarian response, staff or team from wherever they are. So I'm very, very glad to join this conversation. So just to mention about myself as well. So I bring on board quite extensive experience on monitoring, evaluation, accountability, and learning, and also social behavior change communication. And then, of course, trying to look at what is the intersectionality between these two very, very important components of programming in the spaces that we work with. So, yeah, so I think that's all. Probably if there's a question about me specifically, then I'll be glad to respond to. Are you able to hear me clearly?
Yes, you're able to hear, but you're breaking a bit.
So today we on this conversation.
Please proceed.
So we're discussing bridging the gap using SBCC to connect policy. Okay, to connect policy, practice, and local knowledge. So the agenda will be very specific and very focused. So the focus of the conversation, I'll also contextualize this conversation. Then I'll provide a brief definition of SBCC. Then I'll also speak about the gap, policy, practice, and local knowledge, or what I'll call the indigenous knowledge, and how SBCC can, be utilized to bridge the gap. And then, of course, I will also slightly have a conversation around Tanzania and Malawi as case studies for some of the best practices that have been documented. And I'll also share a bit about the challenges in using SPCC in bridging the gap between policy and practice. And then, of course, how then do we overcome the challenges? And then looking into the future, what are some of the reflections that we can have looking into the future? So today, this discussion will center around how to use social behavior change communication to bridge policy, practice, and the local knowledge, and or the indigenous knowledge that we, some of the communities that we work in or we work with possess, or the knowledge that they use to. Okay. So contextualizing this conversation, basically, we are all aware about the, the climate crisis that, they're happening in different parts of the world, the inequalities that continue to persist within the communities, and the, power imbalances between, the different genders, and then, so being able to highlight what are the persistent gaps between, the top-down policies, the field level practices, and the, and the often untapped rich knowledge of local communities. Because I'm sure most of us, if you've interacted with the local communities that you work in, you must have appreciated that they do actually possess a lot of indigenous knowledge, which they actually utilize to solve some of the community-related problems within their reach. So, social behavior change communication provides us with a structured but flexible approach, to bridge these, these existing gaps or divides within the communities. So why do we need to have this conversation today? So it's important to mention that the desire to shift existing social norms, and social norms here, and basically it means some of the existing, rules or that guide how people behave in certain communities. It could be, somewhere, in the middle of, let's say, Malawi, Tanzania, in a particular community. So this is how people behave, this is how people talk to each other. So those are some of the unwritten rules that govern how people relate with each other. And then demands for so ensuring that everybody is brought in on board. So now, briefly, just talking about what exactly is SBCC. So SBCC, I will not go to the technicalities of it. I'll just mention some very key components of social behavior change communication. And one to mention is that it's a research-based and a consultative process that utilizes communication. So communication is very key, it's a very strong core element within the success of social behavior change communication. And then utilization of communication to promote and facilitate the change of behavior, and supporting the social and structural conditions that are able to sustain that change. So it's basically using communication to influence change, okay, within the spaces that you're working in. So SBCC is strongly leverages communication to influence knowledge, okay, and this is sharing of information, attitudes, towards a particular behavior, and influencing the behavior. What is the intention to behave? And then the social norms across the individual level, at the community level, and the systemic level, at the national level. So briefly, just to mention, not very in depth, some of the theoretical foundations that support the discussion around social behavior change communication. And one of them I would speak and I'm sure some of you might have interacted with them, is the theory of planned behavior, where your attitude, your norm, the norms that define the way you relate with each other, affect how you make a decision towards changing a certain behavior, And then some of the components that, define SBCC, approaches. One of them, of course, I talked about formative research, and this is basically trying to understand, before you implement a certain program, what is the current situation within that particular community. So if you, before you even, try to propose a policy change, what is the current situation before that proposition of the policy? So it's very important, the needs of the audience, of the stakeholders that you want to address. What are the existing barriers? What are the preferred communication channels, And then deploying multi-level intervention. So this is basically very targeted communication at the individual level, at the community level, and at the policy advocacy level, which is at this. Then when you talk about an iterative process, it's basically ensuring that when you're designing SBCC programming to influence change of policy, you need to include in the process, spaces for collection of feedback, from the community, because these are the people that are going to actually, benefit from the policy change or the policy proposition. So it's very important to create space for feedback and accountability mechanisms to continue refining the strategies on SBCC. Policy, practice, and local knowledge, or indigenous knowledge. And just before we speak about the gap, what exactly is a policy? A policy is a set of decisions or commitments, okay? Intended to direct or influence actions towards achieving specific societal goals. It is typically developed by governments or institutions to address public issues. So one thing just to clarify about policy development, most of the time we usually talk. Yes.
Hello, Brian. Please share your screen. We are not able to see.
Yeah, so just to mention is that these policies are usually typically developed by governments or institutions to address public issues. And most of the time you'll find that they are actually top-down. Yeah? They are not consulted from the bottom-up approach. And then, of course, usually backed up by evidence, but a bit more abstract, designed at the national or international level. So some of the limitations, some of these policy proposals, they lack local relevance, flexibility, or enforcement mechanism or difficulties. Okay. Now, in practice, okay, so when these policies are actually pronounced, they're usually executed by practitioners like myself and yourself, educators, non-government organizations, community-based organizations, and usually what are usually some of the gaps? Because you realize some of these policy propositions, because they're done, top down, without actually bringing on, scanning the operational environment to understand what could be some of the limitations that some of these policies might be facing. And one of the limitations is usually, resource shortages, inadequate technical capacity or training, or misalignment with policy intent. So, and that's why sometimes, in some governments or in some countries, you'll hear policy propositions, and then within 2-3 months, they retract those statements, and then simply because the communities or the citizenry they were able to, respond and react against that. And for example, teachers promoting literacy policies may lack materials tailored to local languages. Some of the policy, changes, and for example, in Kenya, is a change of education system. A lot of feedback has been provided, formally and informally, to the government or the policy, holders, that there are specific challenges, aligned to specifically resource allocation or resource inadequacies or technical capacities that are, inhibiting the successful implementation of the new education system. So that is usually one of the, gaps in practice of policy that exists in the communities that we work in. Now, speaking about the indigenous knowledge of the communities that we work with, how then do we, characterize this knowledge? It's very context specific and rooted in tradition, experience, and cultural values. Sometimes we go to communities to work with them, but we do not get to interact with them to understand what exactly do they actually have, the local knowledge, the capacity or the knowledge to address some of the problems they do, go through. And most of the time, and because I've been collecting data, you'll realize that these communities do actually have a lot of, useful technical, or rather what I would call in this indigenous knowledge in solving some of the climatic crises that they actually face in their communities. Then, and that's why probably we might sit, at this other side of the boardrooms and decide, oh, you know what, these communities don't have this knowledge. So why can't we just create an SBCC program that is going to address that particular problem? But when you go down to the communities, then during the implementation, you realize you did not spend enough time to, during the formative study stages, to understand, do these communities actually have knowledge? And, and what specifically do they actually need to be able to address the problems they do have in their communities? In many communities, we realize there's a way they have, documented the experiences, but it's very easy to say that, the experiences or knowledge is undocumented or is informal, all right? And then what is the disconnect, between policy, the practice, and the local knowledge, policies fail without practical support, and when you do not have the capacity to tap into the local knowledge, then you will have, outcomes which are actually inequitable. You'll realize it's only a smaller number of the community that are seemingly, benefiting from the shift in policy changes within that particular community or within that particular country. So that is usually the biggest disconnect. When you lack the practical support from the local communities that whose lives will be influenced or affected positively or negatively by the policy shift, by the policy maker. So that is usually the disconnect. So then, how do we bring SBCC to bridge that disconnect? So the role of SBCC in this space is basically to translate policy into actionable communication for practitioners and the communities at large. Okay. So how then do we do this? So it's very important for the policy makers, policy holders to conduct a stakeholder mapping. Okay, to identify who are the key actors in that space, particularly if it's about a policy shift in the health sector. Who are the key players? Do we have the faith-based organizations in, broken boards? Do we have, the ministries, in charge? Do we have the key government agencies? Do we have the private sector? Do we have the non-government organizations in place? And then once you identify these are the key stakeholders that have direct or indirect influence or affect the successful implementation of these policies, then you develop the training modules or the kits or the campaigns that will actually, support the successful operationalization of that policy. Then, of course, you continuously monitor, the feedback to continuously ensure that the approaches are refined. So how then can you do this? You can carry out, capacity strengthening workshops, nowadays with the integration of technology, we can actually have it virtually done or physically done based on the availability of resources, mass media campaigns, um, like for example, National Diabetes Policy can use SBCC to train pharmacists with visual aids on diet counseling, and it can actually be localized to the local languages within that particular community, so that the messaging is culturally appropriate within that particular community. Very important. The other aspect I would like to speak about is how then we incorporate the indigenous knowledge into policy and practice. SBCC positions communities as active partners. Okay, so that now we are able to amplify with its consultative nature. So how then do we use this process? We can carry out ethnographic studies, and this where you can actually, these are studies specifically for specific ethnic groups. You can utilize participatory approaches like visual aids, storytelling to document local practices, and about SBCC in health promotion, where you document a story, spoken word. The spoken word appeals very strongly to human beings. Most of the time, more than 100 pages of reports. So it's very powerful. Then co-designing intervention. So programming, when you bring on board the local actors, the local communities on the table to co-design interventions with them, so that you're able to ensure the programming or the policy shift that is being discussed, was being trickled down, is culturally responsive. It fits within the cultural space, and then advocating for policy adjustments based on trusted evidence. So when you're designing the advocacy strategy, then you're able to take care of or utilize the evidence or the data that you have to be able to know this particular stakeholder. These are their communications based on the policy shift. This is how these are the mediums of communicating to that particular stakeholder based on the policy shift and the evidence that you've gathered. Then what are some of the mechanisms? Policy briefs, for example. So if you're giving feedback on a policy shift to, let's say, for example, government institution, a policy brief is usually the best and share the feedback to them. And then, community radio, and most of the places, in Kenya, Tanzania, Uganda, you guys, there's so many local radio stations, and they are very effective in passing across the information. So one of the programs that I work for when we were doing the headline evaluation, we realized the local radio stations in the northeastern part of Kenya, the information they were passing across on gender-based violence within the community was able to cross the border to Ethiopia and Somalia. So for us, that was a very great success, because we documented an intended consequence of a specific shift in behavior change within a particular community that was being driven by the local communities themselves from that particular community. So for us, that was very, very successful. So ensuring there's a two-way communication role on SBCC, so it's very important. And I said earlier on, it's important to ensure there's a feedback mechanism from the community to the policyholders and the practice part of the policy implementation. And this helps to analyze data to identify the trends and the gaps, and ensuring this multi-sectoral, approach in, so what are some of the mechanisms, as just before, as mentioned earlier, is that there's something called citizen journalism. This is basically bringing on board the community to be part of the, sharing stories, within the spaces we have. People able to, discuss about them. So It's very important to put that across. So let me speak about what are some of the, just briefly, when you're designing some of these SBCC strategies to support policy implementation and bridging the gap, one of the key things is ensuring cultural resonance. The messaging is culturally responsive, segmentation of the audience, ensuring each key stakeholder receives particular information based on their communication needs. Then what are some, what is the long-term vision, the strengthening capacity of the community, for sustainable institutional change in the long term to ensure that the policy changes being proposed do not leave a gap or do not continuously entrench inequalities within the communities or within that particular country in the long run. Let me speak very briefly of some of the successful case studies of, utilization of SBCC in bridging the gap between policy, practice, and local knowledge. So there is this particular program in Tanzania, and you can spend some time later on looking at it, on maternal and nutritional child nutrition. So the policy, which was introduced in 2016 in Tanzania, aimed to reduce stunting by promoting exclusive breastfeeding, but rural uptake remained very, to shift, the uptake, of probably the exclusive breastfeeding in the rural communities. One is that they conducted the formative studies, to identify what are the barriers, So they collected qualitative data, talking to the mothers, talking to the husbands. And then the very interesting intervention they proposed was wazazi nipendeni, okay? So, so this is basically the campaign that they used to radio dramas featuring relatable characters. They send SMS reminders for clinic visits to, to the mothers, the community health workers. Their trainings were strengthened on addressing existing needs, and of course now ensuring the FBCC approach was multi-level strategy because at the individual level they were targeting the mothers. At the operational level, they were targeting the community health work. And then, of course, now overall influencing, the outcome of the program. Then, of course, local integration, incorporated elders, proverbs about child strength into messaging. I will invite us to, look at this, success story. It's very interesting. It's quite long. You can spend some time, looking at it. So then, how was the impact realized, in Tanzania? So the community health workers campaign initiation. So the community health workers launched a campaign to promote breastfeeding. Then breastfeeding rate increased from 49% to 72% in target regions by 2023. The other outcome is the community health workers successfully became the ambassadors of the policy shift, bridging the gap between clinics and homes. So then what happened then to sustain the change in the policy shift? So what was the existing incentive? Okay, what was the benefit? What did the community health workers stand to benefit? So the policy was updated to fund community health workers' incentives based on the campaign success. So this is a very interesting or very clearly demonstrating successful integration of SBCC in bridging the gap between the policy proposition, the practice, and the local knowledge of the community, because the community health workers are local, it's a local in that particular community. We have the policy, in terms of the promotion of breastfeeding, and then we have the success, which is 49% to 72%. So formative data was collected, which informed the successful SBCC design to bridge that gap. So what was the lesson? Local voices amplified trust, multi-channel delivery ensured reach was successful. So it's very important, local voice amplification. briefly speaking about child marriage in Malawi. In Malawi, in 2015, there was a policy on Marriage, Divorce, and Family Relations Act. So its operationalization faced challenges in enforcement. And so with the 42% of girls marrying before 18 due to poverty, traditional beliefs, and limited education opportunities. So how then did they deploy SBCC? So they collected evidence, qualitative data, community dialogues, identification of poverty and traditional norms as key drivers, while highlighting the local youth and traditional leaders as potential change agents. So they designed a locally acceptable campaign, which was called Lekani Ngaka, Ndaka. Okay, so this is it's a highly spoken language in Malawi. It's called the Chichewa language, and Lekani Ndaka in Chichewa language it means stop child marriage. Okay, so this campaign utilized community radio programs, youth-driven peer education, and training for traditional leaders. All right. So how then did they do the integration? So the campaign, the messaging for the campaign was incorporated proverbs with local stories, emphasizing education and empowerment, resonating deeply with the community values. Okay. So how did they do this? So this is the journey. So the success was from the reduction from the highs of 42% child marriage rates to 28%. Okay, as documented by UNICEF. Traditional leaders were, they were utilized as, advocates for change and ensuring the key policy propositions were actually effectively linked within the communities and law enforcement mechanism. And then for sustainability, the national policy revision was revised to incorporate community-based enforcement mechanism, right? So ideally that policy, because the communities or the local knowledge or the indigenous knowledge was incorporated and appreciated, then that is how then this policy has been successful and acceptable within that particular community or within that country. So what is the lesson? Youth drove peer influence, local storytelling, build emotional buy-in from that particular community. So, so as you continually, continue to program SBCC to bridge the gap between policy and, practice and local knowledge or local, indigenous knowledge, then it's important to appreciate that you need to be, developing approaches that are culturally responsive and acceptable within that particular community. So I'll pick on two challenges. One, resistance to change. So we still work in the communities that still have, a lot of pushbacks on changes and particular issues of inequalities, on equities, complexity of impact. Sometimes it's very difficult to measure attribution to a change in policy uptake to a specific organization or specific SBCC, because this is it's a fluid environment where a lot of other key players, other factors are in play. So sometimes it might not be very, it might not be very possible to measure the specific attribution of the change in policy uptake within a particular community. So the much we can do is contribution analysis, where we can, share this is the contribution from this particular organization, from this particular country, in shifting the norms or measuring norm shifts for policy uptake in a particular community. So how then do we overcome some of these challenges? Ensuring stakeholder buy-in, very important. And this helps to, to bridge the gap between the pushbacks and inability to penetrate in the community. Then inclusive design, and this is basically where, like for example, in Malawi, storytelling was very powerful. It effectively engaged the rural communities, and of course, enhancing the understanding adoption of anti-child marriage policies. And then very important, documenting evidence, very important, So combination of quantitative data and qualitative data, such as the most significant change stories, so that these stories, once they're documented, they can be used to communicate and influence change of policy in other communities. Like for example, in Tanzania, storytelling revealed normal shifts, which they were not well documented through the quantitative surveys that they were rolled out. Okay, so then looking in the future, how then can SBCC enhance its effectiveness? Of course, partnerships, very important. And this helps to overcome resource limitations. Technology, we are in the current space of AI. How then can we utilize AI to strengthen SBCC programming? Balancing between standardization and customizations, ensuring the policies are relevant and adaptable to local communities, and then leveraging on existing local knowledge. And this is what in the localization space we strongly advocate for, that we identify and strengthen the existing knowledge locally within this particular community, because this is the only way that is evidentially proven to support the sustainability of change of behavior or change of policy within that particular community. Very important. Then, as we conclude, allow me to speak about then how do we achieve effective SBCC in policy implementation gaps. So identification of gaps, of course, we've already talked about that. Coming up with a strategy, that integrates policy, knowledge, and practice. And then identifying, leveraging the local assets to address the community, the gap. So the local asset here is basically the local knowledge, the indigenous knowledge, and then implement the mindset, foster a collaborative mindset for an ongoing impact in a connected world, in the spaces that we work. So, yeah, so I think overall, this is what we wanted to discuss today, bridging the gap between policies, practice, and local knowledge and indigenous knowledge within the communities that we work in. So thank you very much for listening to me. Over to you, Sheila. Any question, any feedback, I'll be glad to take them up.
Great. Thank you so much for that. Do we have any questions? Thank you so much for explaining to us the aspect of how we bridge the gap of SBCC in terms of connecting policy, practice, and local knowledge. So if you have a question, please raise up. But I do have a comment from the Malawians in the house. They believe that the campaign should have read Lekani Kanza and not Ntaka, because apparently Kanza means stop abuse of girl child, and Ntaka means soil or earth. But they're very happy that you've used their example, so they feel very much at home. So thank you so much, Linda, Joseph, and Tokozani, for that very nice suggestion or inquiry. Thank you. And then we have a question from Henry. Henry is asking, how can we use policy briefs as an approach of influencing policy? How can we use policy briefs as an approach of influencing policy?
Do you want me to take that one now, or?
Yes, please take that one now.
So, Henry, thanks for that question. So, when you conduct a formative study, your objective is to gather evidence. So once you gather evidence, policy brief is specifically very important when you're communicating to government agencies. Okay. Most of the time, they have behaved in a way, or rather, they have told us that they are too busy to read 100-page documents. So we have made it very easy for them. So making it very easy for them, it means that we put that report, 100-page document, into probably 2 to 3 pages of information in what we call a policy brief. So once you put it in a policy brief, So what is more important is what exactly do you document in that policy brief? So once you put that information there, then that is what you use to disseminate and pass across to the policymakers or the policy holders and communicate to them. This is what people are saying in regards to this policy direction. Okay, so we strongly believe through these propositions that you're making and what these communities are saying, if they can be a middle ground, then it can be mutually beneficial to everybody in the country or within that particular space. Yes, Henry.
Good. Henry, you can ask your question. You can just unmute and then you ask your question.
Thank you, Brian, and thank you for the response that we've done, and it's quite comprehensive, and I thank you. So I'll just lower my hand at this point. Thank you.
Okay. Thank you so much, Henry, for that. Anyone else with a question? I'm open to receive a few questions. And as you wait for that, Brian, there's a question. Can we use qualitative evidence to generate a policy brief, especially information from focus group discussions? Can we use qualitative evidence to generate policy brief, especially information from focus group discussions?
Yes, absolutely. No? The policy brief actually combines quantitative and qualitative data. And actually, qualitative data is what influences people to make decisions most of the time, because quantitative data speaks to the soul, speaks to the emotions. It is moving. These are people. This is documentation in verbatim. This is what the community does. And then you document it as such. Sometimes some researchers may make a lot of mistakes because they paraphrase what that particular community is saying. So once you paraphrase, sometimes you might end up missing the exact meaning of what exactly they're saying. So we encourage that when you're documenting these policy briefs, you get it verbatim and then pass it across. Yes.
Okay, that makes sense. Thank you so much for that. Veronica?
Okay, thank you. Good morning, everyone. Thank you, the facilitator. I appreciate this presentation. It has been so insightful. Yeah, speaking from the Nigerian context, I want to find out how can we ensure a sustained behavior, looking at the behavioral SBCC model. Take for instance, you go to a community, you do an advocacy on healthy eating habits and nutrition and how to reduce malnutrition and all of that. And this message sync, actually, the SBCC approach worked, but due to some economic factor, poverty and all of that, and high cost of living, high food prices, people tend to relapse. They go back to their old ways of, preparing their meals, old ways of eating and all of that. So how do we ensure, irrespective of the circumstances, irrespective of the economical factor, that this behavior is sustained in our communities and at other levels? Thank you.
Thank you, Veronica. Let me take you back a little bit historically. So when we started the programming in HIV prevention, the SBCC, the messaging that used to come out was AIDS is a killer disease. AIDS is death. Once you get HIV, you are dead. So the death sentence is here with you, looking at you. So because of continuous, evidence generation, collecting of evidence, the messaging started getting the human face of it. So that now we started talking about positive living. We started appreciating now people can get medication that, can push them through for many, many years. So there was a total shift from that. Now, so the initial messaging was basically using an incentive, which is a negative incentive, where you are being threatened that if you do this, you are going to die. Okay, so then we shifted to a different way of incentivizing change of behavior. Now, for sustaining change of behavior within a particular community, so there are so many other factors that are in play, and you've actually rightfully said so through issues to do with poverty and issues. But again, how then do we design the SBCC programs? One, ensuring there's co-creation. And you see, when you're talking about what was happening in Malawi and Tanzania, is that there was co-creation of the SBCC response mechanisms. So then that means the local language, the local community leaders, they're actually involved in the design phase of the program. So that's one of the things. The other thing is, it's very important to, when you're designing the SBCC program, you take consideration of what are the behavior change determinants that you're utilizing. And one of them that usually makes a lot of sense is the risk perception, okay? So you're able to raise risk perception of this particular individual. Sometimes people speak not knowing that something can actually happen to them. So once you communicate, and this is through storytelling, that this is something that's similar that happened to so and so in a particular community, then it can equally happen to you. So then that is, you're raising their risk perception. Then you can also utilize what we call the role modeling. So when you're using role modeling, basically, is that you're also using storytelling to share a success story from a particular community that has similar characteristics from the one that you actually intervene. So that is also very important. Of course, the other thing is about ensuring the local communities design or they drive the agenda in that particular community. And they also participate strongly in designing the response mechanisms within that particular community. So that then overall, you're able to sustain the change of behavior. But again, change of behavior is complicated because at the end of the day, it's an individual level and then move to the community level and also at the systemic level. Thank you, Veronica.
Great.
Thank you for your
Thank you
response.
so much for that. Good. I'm glad you're okay. Alalim, final question.
Okay. Hello, everyone. I hope you are listening.
Hello. Yes.
Okay. Thank you, Brian, for your nice facilitation for this informative topic. My question regarding to the mechanism that we supposed to use on the carrying out this activity. So what is the difference between the accountability for developmental project and for this SPSS?
Please clarify the question, because accountability between SPSS program and the development, or please, I didn't get that
Yes.
clearly.
Yes, the project. Let us suppose that we are implementing an education project, and we have to apply the whole meal package, including the accountability and the mechanism we supposed to use to collect the information we need. So, what is the difference between the developmental context and to carry out? If you get me right.
Mm-hmm.
Yeah.
Okay. So okay, thanks. So I'll probably respond in the space of my understanding of your question, and probably if it will not be very clear, then you can raise the question again through Sheila, and then I'll be able to make a follow-up response. Now, accountability. Now, 2 years back, I undertook a study on the state of aid localization in Kenya. Localization, in brief, is shifting power and resources to the local communities from the donors and the other partners who are providing support to the communities. So what we found out is that from the study is all the local actors we interviewed actually said accountability is one way. One way means the donor is giving you the money, and it's the local communities to, to provide the accountabilities and, and compliance. So what the local actors recommended or requested is, can there be mutual accountability mechanisms where then that the local communities can actually get a platform to engage, the donors. And particularly in this discussion was that the question was on issues to do with capacity assessment, because they felt that the strategies that were being deployed to assess their capacities, they included indicators that did not reflect the local communities and their capacities. All right. So coming to your question is that on accountability in the development space. So my proposition is to ensure that there is an open, mutual accountability mechanism where the local communities can actually give, feedback on is actually the goal that you're trying to achieve achievable within that particular community. And then how then can you rope in SBCC? SBCC, you rope it in when you're actually communicating to the local community. You communicate to them in the language they understand best, in the spaces they actually feel safer for them to be able to execute the program they're actually implementing. And of course, also, what you call the segmentation of the particular community response levels between, the individual community, the systemic level, where the communication you're targeting or you're communicating, it's very specific to a specific segment of the community. So allow me to respond up to that point on that particular question. And then you can actually post the question once again to Shayla, and then I can give you a more comprehensive response in due course of the day or probably the day after. Thank you so much, Hamid.
Thank you. Thank you.
Great. Thank you. Thank you so much for that. Thank you so much, Brian, for the extensive discussion. We have really learned a lot and it has been very participatory and active. And as you wind up, Emebet is saying, interpersonal communication, the IPC method is the most appropriate channel to reach local communities with not cases to mass media campaign. Yes, no. Good. Thank you. He has noted yes. So that's a take for us. So we've come to the end of our webinar for today. A lot of us are asking when we can get the presentation and the recording. Please note, we will be receiving the same by close of business tomorrow. So do make a point to check your emails so that now you can see the presentation that Brian has been presenting and just be able to catch up on what you missed or just putting more emphasis on what he has been able to explain. Thank you so much for joining. Thank you so much for participating and looking forward to seeing you in our trainings as well as our future webinars that are upcoming. Thank you all and goodbye.
Attention humanitarian and development professionals. Are you looking to take your career to the next level? Then you've come to the right place. Humanitarian Global offers self-paced online courses designed specifically for you. With our comprehensive curriculum, you'll build your capacity in the most critical areas of humanitarian and development work. Our course offerings include monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. With Humanitarian Global, you'll have the opportunity to grow your skills and impact the lives of people in need. Visit our website to learn more about our courses and apply today.